Welcome to Breathe, Sleep, Heal, Live, a radio show devoted to helping improve your quality of life with Dr. Stephen Olmos and the team from TMJ and Sleep Therapy Center of San Diego, an educational program where you will learn about pain, sleep, health, nutrition, and more.
Hello, welcome to our program today. I am Colette. I'm here with Dr. Farshid Ariz. We are part of the team at the TMJ and Sleep Therapy Center of San Diego, and we're here today to fill in for Dr. Stephen Olmos, who's away lecturing. We'd like today to share information about our patient care. We want to explain who our patients are that we treat, how you can become a patient, what to expect at your first visit with TMJ and Sleep Therapy Center of San Diego, and why ensuring that experience is exceptional for the patient is so very important to us. We'll share a bit about ourselves first, and then we'll move into more details of the program. I personally joined Dr. Olmos' TMJ and Sleep Therapy team in the year 2000. My background had included healthcare administration and management for both dental and medical providers for 20-some years. I had seen treatments provided for patients with the conditions of pain, craniofacial pain, which is anything in the head and face, specific headache pain, facial pain, TMJ pain, lumped into a lot of different syndromes that people call TMJ, and then snoring and breathing difficulty. And the treatments I saw mostly pertain to pain management and surgery methods. Obviously, it was always with the best intent of the directing doctor, but not always providing the best long-term results for these patients who were in pain, missing quality of life, and very frustrated. And it seemed to them, I'm certain, and to me for sure, that no one really had an answer for them. I felt saddened and empathy for these patients. And then, by chance totally, I moved to San Diego area, and I met Dr. Stephen Olmos, who had a philosophy and protocol for treatment that was entirely new to me. It was for specifically the patients that I referenced before about having pain and missing quality of life, not functioning normally, not sleeping well. And his philosophy made sense to me. He wanted to comprehensively evaluate and find the core problem that was causing the problems, the symptoms that these patients were presenting, and how it was affecting them with pain and quality of life, and ability to function and sleep normally. He explained it to me as I was learning from him that it was like unpeeling an onion. He simply wanted to go through the process to find the cause. In other words, in medical terminology, to get a diagnosis. So then when he had a diagnosis, he could focus on a specific plan of treatment, and his treatments were therapeutic rehabilitation, which is really the standard of care. And he did not want to mask symptoms with medications or jump into surgery before the therapeutic treatment was provided to rehabilitate and heal. He was about non-surgical healing, pain relief based on the cause of the problem. So for me, that was like, wow, this could be that answer. And selfishly, I wanted to be a part of what Dr. Olmos was doing. So I joined the team, and my position was and is to help develop and ensure systems and staff training to provide the quality care and the exceptional experience for our patients. Dr. Farshid Ariz shares Dr. Olmos' passion and his commitment to our patients. He's an amazing individual with great expertise, and I'm going to turn it over to him now to tell his background and his story on becoming a TMJ and Sleep Therapy Center doctor.
Thank you for having me in your program. And I want to give a little bit of background to our audience as far as who I am. I'm a board certified in craniofacial head and neck pain and dental sleep medicine. I'm a graduate of Boston University. I've been practicing periodontics in Los Angeles for past 29 years. I'm also a faculty at University of Southern California Ostrow School of Dentistry. And I've been enjoying treating the patients, whether it's for periodontics or whether they're coming to me for craniofacial head and neck pain or dental sleep medicine, because I find it very interesting and very important to basically be able to change the patient's lifestyle. And we have the potential and capability of diagnosing and helping patients in any which ways that we get to see them. Initially, when the patients are examined in our office, we have a system in place which we can have the patients go to our website and download the questionnaires, which basically talks about what they want us to basically have focused on their chief complaint. And we get to see the patients in about an hour or so in the office examination, which includes some intraoral and postural photo, and we'll look at their, evaluate the cranial nerve examination. We'll do a muscle head and neck examination, and if need be, we can do some radiographic three-dimensional x-rays to view their jaw joints and upper and lower jaws to be able to get to the correct diagnosis and process of what we need to do.
We want to share with you that there are no age boundaries for the structural and musculoskeletal problems that cause the head, the facial pain, the jaw pain, the breathing problems. Children experience this as well. And the thing with children is that they don't know anything different. Many of them had developmentally not grown the way they should, with no fault of anything other than what has happened to our food intake, our environment, changes in lifestyle. And they are in pain, not even aware that it's not normal. So many parents that bring their children to us are stunned to find out when we ask the child, does that hurt, or do you have headaches, that they do daily. They have trouble in school. They have problems that no one relates to a child having because the child doesn't verbalize it at the level of an adult because they don't know that it's not normal. So that in itself is really sad. Good and bad, I should say bad and good. I found out that both sides of my family, my children's grandchildren, have these kind of problems. So it was not happy for me to hear that, but it was wonderful for me to know that there were reasons and there were treatments. So we have lots of grandbabies in different levels of treatment right now in different areas. But for you to realize that this is not limited to adults. We treat adults and children, male and female. And as Dr. Ariz explained, there's lots of conditions that mark a potential patient for us. And he evaluates, Dr. Olmos evaluates that at the first appointment. Maybe, Dr. Ariz, you could share what some of the symptoms might be of patients that we would help?
Sure. Often patients are curious as far as whether they have referred from their physician or their general dentist. So, and they have questions is very valid. And for example, they ask, why I was referred to a TMJ sleep therapy center. So my answer to them is that, I want you to understand what we probably need to talk about. And chronic headaches are often symptoms of undiagnosed conditions of sleep-related breathing disorders or an injury to temporomandibular joint and surrounding structures. The doctors in our office have been able to find the primary cause and provide effective treatments for thousands of headache patients. They also ask, listen, I'm confused. Why is your name at TMJ Sleep Therapy Centers? And in response to that, we say, well, TMJ is the term patients are most familiar with, and it is the most common component of craniofacial pain. And secondly, both TMJ and sleep apnea can be successfully treated non-surgically with oral appliance therapy. And these two conditions are often comorbid, meaning that they're both interrelated to each other. And again, the doctors in our office are skilled in identifying and addressing the primary problems for the best treatment direction and successful long-term results. And also, if they have a question as far as, hey, listen, I already have splint, I already have night guards, so what's so different about your treatment? And I'll tell them, unlike splint, the orthotic appliances that we use, they're called orthotic because we are addressing the jaw joint, and just like any other joints in our body, if there is a correction that needs to be done, and is done with the help of the orthotic appliance. So we use our individual diagnosed using a reviewed bite registration to provide the best position and fit for healing. They are used in short term, approximately 10 to 12 weeks, to provide support and protection to the joints during the rehabilitation process. So why do you have to wear these appliances 24/7? One might ask. But the rehabilitation is not limited to daytime. And as we know, during the day, we are upright and conscious. During the sleep, we are prone and unconscious. So that by itself creates a different anatomy in our body. Additionally, we have consciousness daytime function and habits, and we have unconsciousness nighttime functions and habits. Both must be addressed for optimal healing.
Thanks, Dr. Ariz. Those are such good answers to very common questions. I want to interject before we go on with more questions that the patients have presented to us, or the audience that has submitted, on how you become a patient. We've had questions on, do I have to be referred? So we want to just let you know that our patients come to us by both professional doctor, medical, dental referrals, by previous patients who've spoken about their treatment and how it's changed their life, by self-referral, because the patient's been searching for help with their condition and they find Dr. Olmos' information and the TMJ and Sleep Therapy Center of San Diego website, which is www.tmjsleepsd.com. So there's a lot of information there. We would invite anyone to review. And of course, once you're on the site, you'll have options to directly email us with any questions that you have pertaining to your particular situation or your child's particular situation. You can talk to us personally. The phone number's on the website, and it is 619-466-2774. You do not have to be a patient of record or ready to make an immediate appointment to call in and talk to us. Let us know what your concerns are, things that you have questions about. That's our goal, to be there to help any patient who is having anything related to the jaw pain, the head pain, the facial pain, headaches, sleep problems. Most importantly, we would want you to know that a referral is not required to be a patient with TMJ and Sleep Therapy Center of San Diego. And we are always available to answer questions and concerns that patients have about our patient care. So please don't hesitate. Again, it's www.tmjsleepsd.com. And our number is 619-466-2774. Dr. Ariz, we have some more questions, if I may ask you and have you fill in the dots. Sure. Okay. So a lot of people have this question. They say, so I'm sure I only snore. I don't have sleep apnea. I'm sure I don't. I just snore. So why can't I get an appliance for just snoring?
Well, Colette, if it's truly just snoring, yes, you can. But neither you or the doctor can be certain the snoring is not symptoms of sleep apnea without proper diagnosis. Treating a patient for snoring when it is really a sleep apnea can have life-threatening results.
Makes sense. So the issue is not that you can't treat snoring with an appliance, but that you need to make sure it's just snoring. Is that right?
Yes.
Okay. So another good question here is night guard. So I've used a night guard. It really wasn't that helpful. So why am I going to move into a snoring appliance or sleep apnea appliance if the night guard really didn't work for me?
Yeah, good question. A night guard is typically made to protect teeth that are being worn down due to unconscious behavior during sleep. Often that behavior is due to breathing problem the patient is not aware of. It makes them unconsciously move their jaw around all night to get better airway. A sleep appliance is specifically designed to maintain an open airway.
All right, Dr. Ariz, now we have a question from the audience regarding a night guard. It really wasn't that helpful. So how can you explain the difference from a night guard that I wear at night when I sleep to what you're saying is a sleep appliance? What's the difference?
Right.
Yeah.
The concern about patients having a night guard and when they are not diagnosed properly, meaning that they have not been gone through a sleep study, whether it's a take-home sleep evaluation or they actually go to the sleep lab to spend the night to get diagnosed correctly by a sleep physicians. And the problem becomes if you already have a potential and being at risk of having obstructive sleep apnea, which we know is a collapse of the airway at night, and you already have a night guard, and that night guard actually causes and possesses different issues because you can't breathe comfortably, and here you have a night guard that is fabricated for you to prevent grinding, and that's going to cause more problem. There are literatures have shown that 50% of the patients wearing a night guard which are not diagnosed correctly can cause more severe obstructive sleep apnea. So that's why we encourage to make sure that you have diagnosed properly, and it's imperative to get the right treatment and right appliance.
Makes perfect sense. Thank you, Dr. Ariz. To our patients, we can just let you know that we will help facilitate a sleep study and make sure the diagnosis is correct for you when you become one of our patients. So now we have a patient asking, I thought the only treatment option for diagnosed sleep apnea was something called CPAP. So are you saying there's an appliance I can use instead?
Yes. Oral appliance therapy is one of the recommended treatment options for patients with diagnosis of mild to moderate sleep apnea. The oral appliances is worn in the mouth to keep the airway throat open during the sleep by controlling the position of the tongue and lower jaw. For severe cases, for example, oral appliances can be used in conjunction with CPAP to make it more tolerable to wear.
I can vouch for that. My daughter's husband, my son-in-law, was to wear CPAP because he has severe apnea at age 30 and not heavy, nothing that you would look at him and suspect. And he couldn't tolerate it at all, so he wasn't treating it. It alarmed my daughter. And he made a visit to a doctor trained and certified in dental sleep medicine, and they designed an appliance that he wears while he wears the CPAP, and now he'll wear it, and now he's going to be around a lot longer for my grandchildren. So happy to hear that there's actual results for that. Thank you, Dr. Ariz.
Sure.
So let's see here. We have someone else. Perfect. This kind of relates to my son-in-law, who is not heavy, not as anything that you would look at and say, oh, I bet that guy has sleep apnea. This particular question is about, let's see here, snoring. I thought snoring was related to age and size. Why do I hear loud snoring like noises from my little child?
Right. Snoring is as an indicator of possible sleep apnea conditions. Sleep apnea has no boundaries of any age or size, as you know. In fact, there is a 70% overlap between snoring and apnea in children. There are staggering numbers, and the reason the American Association of Pediatric Practice Parameters state that all children should be screened for snoring. An affirmative response for snoring should be followed by more detailed evaluation, if you will.
Again, it makes sense if we just think about it. Sleep is supposed to be restful, and I know I witnessed my grandchildren sweating profusely during sleep, flopping all over the bed, wrapped up in sheets when they woke up, tangled bedding. One of my grandsons had a bedwetting problem for a number of years that now I know equated to a breathing disorder, sleep apnea, and improper treatment, it stopped. So there are so many things that relate to sleep disorders in children that affect their daily lives. So it's great. Whomever sent that question in, that prompts lots of information for us to share with you. Please visit our website. There is information and even a test you can take privately for yourself or your child to find out if indeed you might have a potential condition like this that we can help you with. Again, our website is www.tmjsleepsd.com, and our number is 619-466-2774. I think we have a couple more questions we can get answered for you in this segment, and then want to remind you, if you missed any of our programs with K-Bright, they are available on our website as well. So this one is about the TMJ problem, Dr. Ariz, and this person says, I've been told the only real treatment option for a TMJ problem is surgery. Is that true?
Well, the standard of care is always to attempt non-surgical rehabilitation before invasive surgical procedure, Colette. The percentage of patients who need surgery is extremely low.
So we respect greatly the oral surgeons and their skills, and I can say that because part of my career was in that direction. They almost always will recommend the standard of care to try something non-invasive before surgery. So oftentimes we have oral surgeons who refer their TMJ patients to us for us to evaluate and determine if the non-invasive therapy, the approach that Dr. Olmos has for rehabilitation and healing of the joint, might be an option before determining to proceed with a very involved and potentially unsuccessful long-term results of surgery. So I guess you're saying, come see us first.
Yes. Well, I mean, as Dr. Olmos has said numerous times, Colette, in pediatrics, we can prevent obstructive sleep apnea, whereas in adults, we manage it. And that's really, I can emphasize how important it is for function and change of lifestyle, even at very early age. And we can help. We can help by screening the patients. We can help by evaluating proper diagnosis and correct treatment planning. Sure.
Sounds really good. So to remind you, I know I just said it, but there is a test, a self-test that you can take for yourself or your children, a loved one, on our website and submit to us for us just to review and let you know what potentials there are, answer any questions, and then help you to get scheduled for an appointment with us. Our first appointments are simple to schedule. You call the office or submit online a request for us to contact you, and we will review with you the process for the appointment. It is a very thorough, comprehensive evaluation, as Dr. Ariz described. So it is of length, and we do have forms that we either send to you or you can download from our website that you fill out with information about yourself, information that you would not typically request of a dentist. So take a look at our website, give us a call, and we'll be happy to get information back to you. Again, it's www.tmjsleepsd.com, and the number is 619-466-2774.
Be sure to listen to Breathe, Sleep, Heal, Live every Saturday at 11 a.m., where you will hear from the experts at TMJ and Sleep Therapy Center of San Diego. Visit us at tmjsleepsd.com and learn more about treatments for chronic pain and sleep breathing disorders. Or if you have any questions you would like us to address on the next show, please email us at info@tmjtherapycenter.com.